Hi everyone, my name is Dr. Sandev Singh. I'm a consultant gastroenterologist and hepatologist here at Thomson Hospital, Kota, Damansara. So today we'll be discussing some common gastrointestinal problems and what it means to your health and how it affects you. I'm a male in my late 40s. I have a family history of colon cancer. Should I be worried? The short answer is yes, you should be worried. If you're in your late 40s and you have a family history of colon cancer, you should consider yourself being seen by a gastroenterologist for a colonoscopy, which is a simple procedure which examines the whole length of your colon. Now, the risk of colon cancer varies, and it depends on when your family member got diagnosed with colon cancer and also how many members in the family have been diagnosed with colon cancer. Doctor, sometimes when I take antibiotics, my stomach gets all weird. Is there a reason for that? Yes, there is a reason for that. When you take antibiotics, it affects the normal bacteria that lives in your gut. So antibiotics affect that. So it affects that by changing the amount of bacteria in your gut or changing the type of bacteria in your gut. When you take antibiotics, you could end up having a bit of diarrhea, a bit of bloating, a bit of cramps, but it may not necessarily happen to everyone. Doctor, sometimes I feel that my chest area hurts after eating a meal. Is that a problem with my heart or my stomach? If you're having symptoms after a meal, it is usually your stomach. So it could either mean that you're having reflux, acid reflux. It could mean that you're having a stomach ulcer, or it could also mean that you're having problems with your gallbladder. If you're having stones in your gallbladder, you can also have symptoms after a meal. Saying that though, if you're a smoker, you have a family history of heart problems, hypertension, and high cholesterol, then you should also consider seeing a cardiologist to get that checked out. Are there any over-the-counter medications that you could recommend to treat food poisoning? If you're having food poisoning, the main aim is to prevent dehydration, because when you have food poisoning, your body loses fluid, so you have to replenish. So you can replenish by just having water or juices, but if you feel like you need something else, you could consider going to the pharmacy to get some oral rehydration salt, which is easily available in pharmacies. You can also get some simple medications for cramps like Buscopan. Food poisoning tends to resolve on its own within 24-48 hours, but if it lasts longer than that, you may need a course of antibiotics, so consider seeing your doctor for that. What food should people with gastric avoid? So number one, avoid spicy food. Too much spicy foods. You may not need to avoid everything, but you just need to limit. Things like fatty food, fried food, carbonated drinks like Coca-Cola, too much alcohol, so limit the amount of alcohol you drink, and try and keep your cups of tea and coffee to less than 3 cups a day. Does pain at a different part of the abdomen mean a specific thing? This is not absolute, but yes, if you have, for example, if you have pain on the right side of your abdomen, just below your rib cage, it could be related to problems related to your liver. Your gallbladder could be inflamed. If it's lower down, just above your groin, it could be an appendix causing problem. If it's right in the middle, it could be your stomach or your pancreas. So although this is not absolute, it could mean that having pain at different parts of your abdomen could mean different things. Is it true that you can live without an appendix? Why is it there then? So yes, it's true that you can live without an appendix. There are lots of people who have appendicitis and have the appendix removed. Why is it there then? It was thought to be a useless organ in the past, but now we are seeing that appendix is good to protect the good bacteria in your gut. So that is, I suppose, why it's there. What causes stomach ulcers? So Helicobacter pylori infection. So that's very common. We see that day in, day out. It's the commonest cause of stomach ulcers. And then the next would be medication. So if you are someone who has arthritis, for example, you may be on certain medications like ibuprofen or Celebrex. So these medications can cause stomach ulcers. Stress and spicy food does not cause stomach ulcers, mainly causes inflammation, which is different. For more information, feel free to contact us at Thomson Hospital, Kota, Damansara. Thank you very much.